can I know the causes of this obstructive sleep apnea? And is there any risk factors that increase the likelihood of developing it?
So that actually brings us to the symptoms which are the daytime symptoms. Now, if the person is actually having a fragmented sleep, like how we just spoke about, that the person is not breathing properly. When a person is not breathing properly, obviously the quality of this sleep gets affected for this particular individual. Hence, what happens when that individual wakes up in the morning, one, he is not very happy to wake up. The moment he wakes up, he is not filled with energy to jump out of bed. So he is very sort of lethargic to the fact that he has to get up and go about with this day. So one of the commonest symptoms, in fact, of this kind of sleep fragmentation that happens during sleep results in what we call as EDS, also known as excessive daytime sleepiness. So this individual actually has no energy, feeling fatigued, feeling tired, feeling like taking a nap whenever possible. So one of the commonest problems would be for a person to sleep off during their work. Now, if it's a car driver and the driver is falling asleep when the car is driving, it's bad for the passengers of the car, it's bad for himself, and also for the people on the streets. Point number two, if the person that we're talking about is a loco pilot or an airline pilot, their judgment would be very clouded, obviously causing putting the lives at risk and threat. If these are the immediate complications, a lot of them are actually cardiopulmonary problems. For example, there is an increased chance of heart attacks, there is increased chance of drug-resistant hypertension, there is increased chance of what we call as rhythm disorders of the heart, and also a lot of impact on the brain, especially working memory, as we call it. That is, recent memory gets affected, your judgment will get affected or get clouded. And the term which we came to know recently and became very common after COVID, which is brain fog, is one of, again, very common symptoms of obstructive sleep apnea.